Hello, my name is Dr. Dewan S. Raja. Today I will discuss about cruciate anastomosis and trochanteric anastomosis. The cruciate anastomosis is an arterial anastomosis located over the upper part of the back of the femur at the level of the lesser trochanter. This anastomosis is formed by the following arteries. Inferior gluteal artery from the above, medially by transverse branch of the medial circumflex femoral artery, laterally by transverse branch of lateral circumflex femoral artery, from below by the ascending branch of the first perforating artery of the profunda femoris artery or deep artery of the thigh, also called arteria profunda femoris. Okay, so we got the cruciate anastomosis. So we have the first perforating artery going there. We have the medial circumflex femoral artery. We have the lateral circumflex femoral artery. Okay, and we have the inferior gluteal artery here. So here is the anastomosis around the lesser trochanter. The cruciate anastomosis is significant because it provides an important collateral pathway for blood flow, ensuring that tissues of the thigh and hip receive adequate oxygen and nutrient even if there are blockages or issues with the primary blood vessels. This anastomosis is a connection between the internal iliac and femoral arteries. Okay. So internal iliac artery, like the branch like inferior gluteal artery, and the femoral artery branches from the profunda femoris artery, first perforating artery, the medial circumflex femoral artery, the lateral circumflex femoral artery. So it is a connection between the internal iliac and femoral arteries. Trochanteric anastomosis. Anastomosis means connection between the arteries or veins. Here we are talking about the arterial anastomosis. Trochanteric anastomosis is located at the trochanteric fossa and greater trochanter of the femur. This arterial anastomosis is important for supplying blood to the hip joint and surrounding structure. Trochanteric anastomosis location is a bit above the cruciate anastomosis. This arterial anastomosis is formed by the following arteries: superior gluteal artery, inferior gluteal artery. This is the descending branches. Medial circumflex femoral artery, lateral circumflex artery. From these two, we are getting the ascending branches. So we have four arteries forming the trochanteric anastomosis, located at the trochanteric fossa and greater trochanter of the femur. Okay. These arteries form a vascular network around the greater trochanter. Okay, we have got that here. Superior gluteal to the trochanteric anastomosis. We should have the inferior gluteal. Okay. We have the lateral medial circumflex femoral arteries. Okay. Going to make the trochanteric anastomosis here. Okay, so we have the medial and lateral circumflex femoral artery ascending branches. So we have this is the trochanteric fossa, just behind it. This is the greater trochanter. So at the greater trochanter and trochanteric fossa, we have the trochanteric anastomosis. At the level of the inferior or the lesser trochanter, we have the cruciate anastomosis. Always there is variation. Some individual it may be little up or down. So this arteries forms a vascular network around the greater trochanter, ensuring a robust blood supply to the hip joint, the proximal femur, and surrounding muscles. This anastomosis is a channel of communication between the internal iliac and femoral arteries. Internal iliac branches have the supraogluteal artery, infragluteal artery. Femoral artery branch like the lateral and medial circumference femoral artery, branch of the artery of profunda femoris artery or deep artery of the thigh. So we got the trochanteric anastomosis. Here is the trochanteric anastomosis. Okay, we have the lateral and medial circumflex femoral artery. Okay, they are coming from the profunda artery. Okay, and we have the trochanteric anastomosis and the cruciate anastomosis. And that's all about the trochanteric and cruciate anastomosis. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.